Paula had to restart her computer, so she's sending her apologies and asked us to start in the meantime. So as Kerry said, my name is Hege Vågan, and I will just provide some background to really situate, you know, where the PSAT is actually coming in terms of, you know, our approach to adolescent girls and young women's programming. So I will be looking at the evidence, the guidance and tools all in 12 minutes. So don't bother about, you know, everything that is on the slide. You will be provided with the slides. So I will just run us through so that we have an idea and a visual around, you know, where we are coming from and where you can also find this guidance. So if we go into the first slide, we know that, of course, we got the new Global AIDS Strategy 2021 to 26, and it sets out really ambitious and exciting new targets for us, including use of combination prevention and access to sexual and reproductive health and rights. And I've included the whole, you know, visual of the targets, because as we are dealing with adolescent girls and young women programming, of course, we need to take into consideration the structural barriers, so the 10-10-10 targets, and also the integration aspects together with the 95-95-95 targets. And when we're implementing all of this, we have this ambitious goal of reaching, you know, or reducing new HIV infection among adolescent girls and young women, particularly to below 50,000. So indeed, we have a huge job ahead of us. And as we go into the next slide, you will see that, of course, you know, knowing what is the current status, that every week around 5,000 young women are actually becoming infected, and 4,200 of these in sub-Saharan Africa, we need to really focus on our programs and make sure we are better, or are enabling ourselves to scale up our programs. If we go into the next slide, you will see that we have had encouraging but insufficient decline in the number of new infections. So between 2010 and 2020, you can see that some countries have actually, they are almost on track to reach their target. So Zimbabwe, that we have here with us today, Cote d'Ivoire, they have among adolescent girls and young women being able to reduce new infections with up to 68%, while other countries are still, you know, lagging quite behind in terms of the reduction in new infections. So this just gives us a snapshot. And looking further into the programmatic aspects that the PSAT is focusing on, if you go to the next slide, the Global Prevention Coalition has, for the last 4 or 5 years, been doing adolescent girls and young women thematic summaries. And here again, you will see, you know, from the output to the outcome level, we have some good developments actually in several countries. But still, you can see from the oranges and reds, there's quite some gap in our programming. And this is really where, you know, the application of the PSAT is also supposed to help us to focus and look at how we can improve the programming overall, so that at the end we have this comprehensive package that is able to achieve the results that we need. If we go to the next slide, what have we learned? And I think this is just useful as a background, is that we need a more systematic approach to prioritization and programming. So we need to use the data that we have available, both in terms of the incidence estimates and in terms of the programming. What we have seen is that we have kept on implementing small scale projects rather than, you know, larger scale or scalable programs. And they have often been focused on contextual issues rather than the core programmatic packages of HIV prevention. And we have also missed opportunities in reaching women and young women that are already using contraceptive services. We need a clear theory of change so that as we implement our programs, we actually know that they will be leading to reduced incidence, and define program models that enable us to scale up, and particularly in high incidence locations. And this should include both biomedical, behavioral, structural interventions, and not looking at only one of them or the other. And the same goes also, we need to make sure that we ensure that the prevention program sits within the continuum of programming, so that we have solid treatment programs and testing programs coming together with our prevention programs. And all of this, of course, under, solid coordination and stewardship and engaging adolescent girls throughout. So this is just in terms of the observation, and I think it's known to most of us. So in the next slide, I just wanted to mention briefly some key programs that are already there on the ground, and that all these different tools that we will be talking about, and today specifically the PSAT, can actually contribute towards. And several of you are engaged in the Global Fund Strategic Initiative, and we will hear more about this. Together for SRHR that is being implemented, and now most recently the Education Plus, which is this high-level political advocacy drive led by the UNAIDS Executive Director together with 4 other UN agencies, that is also looking to accelerate actions and invest to prevent HIV among adolescent girls. So as we are using these tools, they can be applied across in several of our programming and advocacy approaches. So the next slide. In terms of guidance and tools, and this is, I thought it was useful just to provide this visual, because before you get to the PSAT, there are several documents that the PSAT is building on, and that might be useful to go back to or to use before also you are using your self-assessment tool. And I will touch on some of them briefly in the next slide, so we can just go to the next. The Adolescent Girls and Young Women and Their Male Partners Guidance that came out in 2016 already provide a lot of the evidence behind the menu option that you see, where we suggested the combination prevention package that should have, both the biomedical, the structural, and the behavioral program aspects to move us forward in terms of our adolescent girls programs. Next slide. And of course, this shouldn't be done universally, that you need the complete package throughout the whole country. So this slide I've borrowed from our colleagues that will be presenting, Jane and Delona. These are supposed to be differentiated packages. So for some program aspects, of course, they should be delivered to the whole populations, but for other aspects, we need to look at the epidemic and our incidence and really analyze the data, and to be able to develop more targeted and decentralized and adopted packages corresponding to the needs. And the next slide. And moving on to some of the other tools that can help us to do this. Many of you might know that we quite some time we have had population size estimates for key populations, but we haven't had for young women and other priority populations. So now, given the new targets, we have developed a tool that that introduce subnational estimates, which differentiate across sex, age, location, and behavior. So you're actually able to use available data to look more into the actual population size, but also look at the different risk aspects and that in the different districts in your countries, depending, of course, on what data is already available. And this way we should be able to have subnational population size estimates as an entry point for actually setting decentralized targets for adolescent girls and young women, something that has been requested for quite some time. So this is now available. And the next slide. And in terms of the programming, like I said, when the 2016 guidance on the comprehensive package came out, a lot of countries felt that we really needed further guidance in terms of actually making decisions on which programs to implement where. So in 2020, the decision-making aid was put forward, which provides a tool to look at based on the different incidence thresholds, what kind of programmatic packages should be implemented ideally in the different areas. And the same thing came also in terms of, like I mentioned, that we hadn't been able to capture women already using contraceptive services. So together with WHO, the Global Prevention Coalition also came out with a guidance on how to strengthen HIV prevention within already existing contraceptive services. The next slide. And this is actually, all of these tools and guidances have been forming kind of the basis of the aspects of the program self-assessment tool that we will be looking at today. So, I mean, I won't get further into the details because that you will get in the subsequent presentations, but I just thought also it would really be useful to mention that, you know, looking at the complexities of the adolescent girls and young women programs, the service delivery platform for scaling up needs to be taken on board already as we start to implement the PSATs, and ensuring that we have the health sector, the education sector, and the community platforms, you know, participating as we are doing the assessment. Next slide. So just to summarize, and this is a mouthful in terms of putting it together. I mean, we want to have data-informed, multi-component prevention programs, and they need to be decentralized and accountable, because unless we do the decentralized approach, as most of you are already doing, we will not be able to create that diversified approach that is required. So for that to happen, the combination prevention packages, as I said initially, what we had seen in terms of the gaps, it needs to include adolescent girls and young women, and also their male partners and young men throughout. This can provide us with increased, you know, precision in terms of both the program, but also in terms of the coverage. If we are using these tools to analyze our epidemic. And, you know, all of this needs to happen together with reinforced HIV prevention leadership to facilitate the multi-sectorial collaboration and oversight. And all of this, of course, together with the strengthening program monitoring and evaluation. So I think this is just, you know, providing kind of what I said, the background to where the PSAT is actually taking us forward. So that is really it from me. In the next slide, you will just see the linkages to the different tools so that you know that you can access and look at them, you know, in detail. And thank you very much. Over to you, Kerry.
Thank you so much, Hege. Colleagues, before I do give my presentation, I just really want to acknowledge that there seems to be an issue with the Zoom, which seemed to happen at about 1 minute past 4, which is why the first 40 participants are on the call. And there seems to be a much bigger Zoom challenge, which is preventing others from joining. But I want to suggest we'll continue with the webinar. We're recording it and we'll then decide whether we rerun this at some stage or share the recording. But I think that's how we will proceed. And so if you are also getting messages from your colleagues saying that they're struggling to join, we will be sending out a mailer if it hasn't gone out already, just to inform people about the challenge. And we'll just continue. So apologies for that. And Ayesha has kindly agreed to take over chairing because our chair is not able to join due to the same issue. So thank you, Ayesha, for taking over the chairing.
Great. Thanks, everybody. So maybe I should just do a quick introduction and then I can hand over to Kerry to do the next presentation. So really happy to be here today. My name is Ayesha Ismail and I'm a manager in the health practice at Genesis Analytics. I work on the Sycona project that some of you may have heard about, and I work closely with the South to South Learning Network. So really happy to chair this call today. Maybe I'll just briefly go over the objectives of this meeting since we didn't have opportunity to do that, and then I'll hand over to our speakers in the interest of time. So there are really 3 specific objectives to this webinar today. The first is to share new evidence and guidance for AGYW HIV prevention programming and what the package of intervention should include. The second is to understand more about adolescent girls and young women's prevention self-assessment tool that Kerry will be going over, to learn how countries are utilizing the AGYW PSAT and what the findings are showing, and then to reinforce the need for involvement of young people in this assessment, design, implementation, and management of programs. So I'm just going to hand over to Kerry now, who is going to take us through and tell us a bit more about the AGYW prevention self-assessment tool. Over to you, Kerry.
Thank you so much, Ayesha. So afternoon, colleagues, once again. Today I'm going to be sharing with you an overview of the prevention self-assessment tool for adolescent girls and young women programming. So what I'm going to cover in the course of this short presentation, I will start by sharing with you what the prevention self-assessment tool is and how it was developed. I will share with you what the objectives are of a prevention self-assessment tool, as well as the components that it assesses. I will also provide an overview of who should be using the self-assessment tool and why, what some of the outputs are that the PSAT can be used to develop, and I'll then conclude with sharing with you where you can access the tool and what support is available to you as a country in order to complete this tool for your own country. So starting with what a prevention self-assessment tool is, well, it is really just that. It's a tool that can be used for countries to assess or reflect on their own country programs. We commonly talk about the tool as a PSAT tool, and that might be a new acronym for you, but it is maybe apologies in advance if we use the word PSAT. That stands for the self-assessment tools. And it really exists to help countries spend time reflecting on the status quo of their own programs. This tool is not intended to evaluate programs. It's not meant to be something used by an outsider to look at somebody else's program, but it's really envisaged as a tool which countries themselves use within their own spaces and within their own existing forums to discuss HIV prevention programs for adolescent girls and young women. And how it can be used really is that it is used by country teams who are able to compare their own programs to almost a blueprint of what a comprehensive program looks like based on global best practice and global guidelines. The intention is that the tool is completed by a group of individuals from a country, such as a technical working group, and then it is discussed much more broadly in a very consultative manner amongst many more stakeholders in the country. You can go to the next slide, please. So I just wanted to share with you briefly the process through which the PSAT tool was developed. The PSAT tool is an Excel-based tool, and how it was developed is it started with a very comprehensive desktop review, looking at what existing programs there were with promising practice, as well as what global guidance tells us and what global evidence shows as best practice. That was then followed up with interviews conducted with key informants at a global and regional and country level, and that information and their insights and input was used to supplement what was found through the desktop review. The dashboards were then developed and piloted through specific countries, and then they were implemented through various initiatives. The tool is publicly available, but some programs do actually support the facilitation and implementation of the PSAT tool. So the original version, or version 1 of the PSAT tools, were completed in 2018. And this whole process was repeated again in 2021. And so currently version 2 of the Adolescent Girls and Young Women's PSAT tool is available online, and it was completed only in February this year. So it really is up to date and current with what the current global environment looks like for adolescent girls and young women's programming. So the objectives of using a prevention self-assessment tool, first and foremost, the prevention self-assessment tools are really there as an aid for country programs and partners. And it is there to support country programs and partners, number one, to recognize and identify what are the characteristics of global best practice for adolescent girls and young women's programming. Secondly, to understand how their country programs are performing against each of the program components. Third, for countries to benchmark their programs' progress against their own prior performance or against a global benchmark of best practice. It's there to support country programs to prioritize certain components where they might need further development or improvement in order to optimize and scale their national programs. It's also there to help country programs identify what their technical assistance needs are, their resource needs, capacity development needs, and where there might be gaps in investments in order to really realize an optimized program for HIV prevention. It's also there for countries to compare their relative performance against other countries who have completed the same tool, and also identify opportunities for learning and sharing across countries. And lastly, it can be used as a tool to advocate for interventions and for resources to improve country programs. So as I mentioned earlier, the PSAT tool really helps countries to assess their adolescent girls and young women's program comprehensively. And what does that mean? It means that all components and all aspects of a national AGYW program can be assessed by using this tool. So that can mean anything from assessing program management, which includes leadership and coordination, strategy and policy and regulation and financing, all the way through the different program implementation components of a national program, the program package of services, and that is different depending on whether the country has high or moderate incidence for HIV, infections amongst adolescent girls and young women, and it also looks at program outcomes and sustainability. So who should use the self-assessment tool and why? So really the primary audience that was identified and seen as the user of the prevention self-assessment tool when it was developed are country level prevention stakeholders who have a role in the adolescent girls and young women's national response. This includes decision makers and influencers, as well as various members of technical working groups. So that would include donors and development partners, implementing partners, civil society, government, UN agencies, etc. However, the PSAT tool is publicly available, and so really anybody who is implementing or designing or evaluating a program for adolescent girls and young women can also use this tool in order to look through their lens at what their program needs might be. What I want to emphasize, though, is that although the content and the scoring of the self-assessment is really important, what's actually more or equally important is the process through which people come together to complete the prevention self-assessment tool. So what the self-assessment tool actually facilitates is it helps to facilitate comprehensive discussion of all components of an adolescent girls and young women program. It also helps to provide some neutrality to some of the discussions that are taking place amongst different constituency groups. It can also serve as a blueprint against which program discussions and deliberations can take place with some objectivity that isn't linked to an individual person who's a part of the discussion. And really it helps to encourage multi-sectoral participation, because this tool can't be completed for a national program by one agency or one institution only. It really needs the voices of all different players in the AGYW response. And so really that is why the usual approach to completing a prevention self-assessment tool is through existing structures that are already there in countries. So if there's an existing technical working group for adolescent girls and young women, or prevention technical working group, those are the groups and structures generally that use this tool and where it's most effective. So what else can be quite valuable coming out of the process of completing the prevention self-assessment tool of the various outputs that the tool lends itself to? So once the prevention self-assessment tool has been completed, countries can then sit together and discuss what are the key priorities or gaps that they have found through the process of completing the self-assessment tool. They can then also document how to address those needs by looking at what the resource needs are that they may have, what the technical assistance needs are that they may have, or what their learning needs might be. And so from the completion of the prevention self-assessment tool, it's quite easy for a country program to develop a TA, a list of technical assistance needs and a country action plan in order to respond to some of the key gaps that have been identified through the process of completing a PSAT. Next slide, please. And so really, I just want to conclude by sharing with you where you can access this tool and by providing an offer of support to anyone who might be interested in finding out more. So all the prevention self-assessment tools for adolescent girls and young women, but actually for all the prevention pillars, condoms, key populations, PrEP and VMMC, you can download these tools in English and French and Portuguese on the Global HIV Prevention Coalition website. And within the tool itself, there are instructions and frequently asked questions where you can that you can read, and that should enable you to complete the prevention self-assessment tool. But also, if you would be interested in receiving a briefing or a training of trainers specifically, you can reach out to Lulama. Her email address is on this slide, or anybody who was organizing this webinar, and you can request for support from us to give a full briefing and much more information on the prevention self-assessment tool. Also through the South-South Learning Network, the 15 countries who are now a part of the network will have the support provided to them by the South-South Learning Network team. And so you should reach out to your country engagement lead, and we'll happily support you to complete the tool. So thanks very much, Ayesha. I think that's all from me now, and we'll hear from countries how they've experienced using the tool.
Great, thanks so much, Kerry. And I see some additional participants have been able to join the webinar, so it looks like slowly the Zoom issue is being fixed, so hopefully we'll have some additional people here over the course. Okay, so now that we know a little bit more about the background of the PSAT and how it works, I'd like to hand over to Rebecca to share some practical experiences of using the AGYW PSAT in Kenya. Rebecca, you can go ahead, and that will be followed by a presentation from the Global Fund Strategic Initiative.
Thank you. So yeah, my name is Rebecca. I work with the National AIDS Control Council in Kenya. I am the program officer for adolescents and the Adolescents and Young People program in Kenya. So it would be nice for us to start by possibly looking at what the current HIV situation is in the country, and then that will sort of help us sort of understand how the PSAT has helped with programming in the country. So we currently have a prevalence of around 4.4%. With 1.6 million people living with HIV. But what is of importance, I think, for the AGYW situation in the country is really around the number of new infections that we have, the people who are living with HIV within those age groups, as well as so at between 10 and 19 and 15 and 24. So this is based on 2019 data, what we have as our 2020 estimates. We have 87,208 adolescents living with HIV. That's between the ages of 10 to 19, and we have 6,150 new infections in this age category. Between the ages of 15 and 24, though, here is where we have higher new infections and more persons living with HIV. We have 142,161 living with HIV, and then we also have 14,344 new infections each year. Next, please. So as a country, we also make sure that we include sexual reproductive health issues as part of the program for HIV, and that's why I wanted to highlight adolescent pregnancies in the country. So this just basically shows the trend that has been there for the past, since 2016 to 2020, there has been an increase in the number of teenage pregnancies in the country, specifically in 9 major counties. That's Nairobi, Kakamega, Nakuru, Meru, Narok, Bungoma, Kiambu, Homa Bay, and Kwale. What these counties are sort of sub-national states, essentially. So within these counties, the thing that is most similar, that the link around them is usually so high population for one, but also we have cities and towns in these areas. And then we also have a county like Narok, which a lot of the teenage pregnancies are usually based off of social cultural issues, so issues around early marriages and things like that, and the community being pastoral, a pastoral community. Next. Okay, thank you. So in terms of vulnerability, and how we have structured the national program for adolescents and young people, is we have been able to identify what the vulnerabilities are and then start to program in that direction. So obviously our program looks at social cultural issues around culture and religion, so that we're able to address vulnerabilities around such as FGM, early marriages, community taboos. We also have issues with education and how we can bring in the Ministry of Education, so teachers, ministers who are responsible for this docket. So we're able to address issues around low retention and transition rates in schools, as well as school attitudes towards HIV that could be stigmatizing. So sexuality education discussions specifically around comprehensive sexuality education, and also HIV-related stigma. So we have issues around lack of economic empowerment, so issues around social protection, for example, how do we strengthen that? SGBV, and then we also have low access to information and services that are HIV specific or sexual reproductive health specific. We also have most at risk adolescents and young people. So those are those who inject drugs, those who are living with disabilities, as well as key populations. Then in terms of alcohol and drug use and mental health challenges which have been brought to the fore over the past couple of years, especially in our country. So how do we make sure that that is a part of our programming? And other emerging issues, obviously, as like COVID-19, which has also put a lot of young girls at risk because they stayed out of school for a long period of time. And then also political instabilities. And I think this year is special, I think, for Kenyans because we're also going into the election period this year. And there's a lot of, fear and worry around post-election violence and what kind of risk it would put young girls and women at if they're not able to be protected during this time. Next. So I think this has already been touched on, but really it's what this process has allowed us to do is be able to start working on our plans of action and what needs we have in terms of capacity, but then also take a step back and analyze our programs based on a global standard, which has already been touched on. I don't need to go through that. Yeah, so I'll take you through the process for the country and some of the findings, and I'll just, for the purpose of time, I will link the findings to some of the things that the country is already doing so that we don't have to go through that in the slides, just that it's a direct link from here on. So the country started this process in July of 2021 to September. The NAC and the NAC, which works in multi-sectoral coordination of the HIV response, in collaboration with NASCOP, was able to bring together different donors and implementing partners to participate in the PSAT discussion. So this included implementing partners such as those who are supported by PEPFAR, like DREAMS. We also had CSOs that were represented, adolescents and young people themselves participated in this process. Then we had 5 sessions, virtual sessions that stakeholders were able to participate in. And these findings have recently been presented to the technical working group for the multisectoral coordination of the response. And so we are at the point of, I think, still continuing to disseminate these findings, as well as planning for the next steps. So just to go through what the scores were. So the 3 domains that were looked at were on program management, implementation, and prevention. And the highest scoring was program implementation. Next. Yeah, so in terms of program management, in terms of policy regulations and strategies, the frameworks do exist, and that's why you can see that there's a high score here. But we are also not doing too poorly with leadership and coordination, meaning that the structures do exist, but we do need to make sure that these structures meet often and are used in a way that actually adds value. Yeah. And then in terms of financing, the score was 2.17. So there is need for HIV financing to be strengthened in the country, and how do we have sustainable programs as well? So just a quick run through on some of the gaps that were identified and proposed actions. And here I could touch on what the country has been able to do since the findings. So we have, under leadership and coordination, the country scored really well on having a strategy and having a strategic plan. However, there's a need to include specific AGYW interventions in these plans, so that we're able to have high impact interventions. So in terms of this one specifically, I know that we have been carrying out an AGYW impact assessment for the interventions that are in the Global Fund countries, but also in other counties as well, just to make sure that we are identifying what interventions are working, why they are working, and for who, so in what context, so we're able to scale that up and put it and make sure it's being implemented in other counties as well. In terms of, so the lowest score here was around capacity building and technical assistance. So in terms of identifying TA that the country needs, we recognize that there was a lot of TA that was being provided to the country, but we were not pushing it in the right directions. The money wasn't facing what our priorities were. And since then, we've been able to have meetings with the different organizations that are offering TA, since we were able to do a program review and identify what our gaps were and what our needs were. And then based off of that, we've been able to now start collaboratively working with partners just to make sure that the gaps that have been identified are what is being prioritized in their plans to support the country. And then also in terms of the technical working groups on HIV prevention for AGYW, there is a need for partner mapping to be done. This process has already begun through the PSAT process. We were able to identify partners who are working in different counties, and from this we'll be able to now start to strengthen that collaboration and coordination. Then in terms of policies, as I had said earlier, we do have, the country has worked on developing policies. It's usually the implementation aspects that usually are not very successful. However, in terms of advocacy towards domestic funding, which was identified as a challenge, we are working with counties to make sure that they identify specific budget lines for them to be able to put money into, so that counties now are able to take on the responsibility of the HIV response in their counties. And we've worked with them to develop county AIDS implementation plans that are linked to the Kenya AIDS strategic framework to make sure that they're able to be able to meet the need that they have in the counties. Okay, next. I have about 3 minutes left, so I'll try to rush through this. I think we've discussed this in terms of what the needs was. Maybe next. Thank you. So in terms of needs assessment, male partners and target setting, so we have a gap that was identified is that we do not have a specific target population for one. So we are also working on a size estimation tool on identifying who the most at risk adolescents are based off of the findings we got from the PSAT. But we've also been able to start identifying what will go into the national plan as a target, so that we're able to measure ourselves against something specific for the country and what we're able to reach. And then the other thing that maybe I could touch on here is that we through the PISA process, we're able to recognize that we don't have an AGYW prevention package. So this is already on an ongoing process in the country to come up with a prevention package specifically for AGYW. But since as a country, we also focus on adolescents and young people in general, that plan will include AYPs, because male partners of these young girls should be part of the process for us to be able to succeed. Next. Yes, I think I've touched on this in terms of the size estimation. Yes, in terms of continuous capacity building of healthcare workers as well, this is ongoing, but we've also been working with the Ministry of Education to support teenage mothers and pregnant teenagers who are in schools, just to make sure that we're providing for them a safe space within the school system and outside of that. And this has been supported significantly by Global Fund. But we're also working with the government to make sure that social protection channels are put in place to make sure that we have a safe space for these young girls to be able to return to school. And we're providing a place for even resources for their caregivers to be able to take care of their children as they go back to school. Next. Yeah, before this, but it's okay. I'll talk about the So another thing that came out of the process for PSAT is how we really need to strengthen the multisexual coordination aspect of the AYP programs in Kenya, just to make sure that we are able to, because young people exist in different circles, and for us to be able to reach young people, all these different sectors have to be put into consideration. So making sure that we are working with these sectors will really go a long way. In terms of M&D, I think I've touched on the national reporting tool for implementing partners. They all report, but we're not able to capture specific data for adolescents and young people or AGYW, and this process helped us identify that gap, but also making sure that our reporting tools are age disaggregated. I think you saw in my earlier slide, we have an overlap between 10 and 19 and 15 and 24, and so that's an overlap that is currently being addressed by the country. I think I've touched on this just so to save on time. Next. Yeah, okay. So this is really about the cultural, social-cultural issues that I had mentioned earlier, and how do we engage the communities that where these young people exist as enablers for the HIV prevention program. So as a priority, I think we can go to my last slide, which is what the section that highlights this, is that the next one. Yes, there. So for the country, this is the direction we are going in terms of developing the plan for the country, because we are in the third. So we had initially a fast-track plan to end HIV among adolescents and young people. That lapsed. We had a second generation. So as we were developing the third generation, we decided to change our focus and start looking at adolescent programming using the human-centered design approach, which takes into consideration some of the social cultural aspects, the multisexual aspects of adolescents and young people, so that we make sure we are providing solutions for young people from the time that they're young to the point that they become adult, and that's what this cycle looks like. So how do we make sure we're delaying sexual debut among adolescents, and then when they're providing menstrual hygiene solutions for young people, then making sure we're preventing teenage pregnancies and continuing with abstinence messages as they continue to grow up, and providing systems even at community level that support our programs, and then making sure we're including mental health and integrating other services as well, just to make sure we don't leave anything out and provide a whole package for these young people because of the vulnerabilities we discussed earlier. And then how do we make sure that they're ready to transition into adulthood, where they're able to make decisions for themselves, negotiate for condoms and other prevention methods, as well as life and career goals, because we know a lot of vulnerabilities also coming from their economic challenges. So I think would like to stop there because I believe I've run out of time. I don't want to eat into more time. Thank you.
Great. Thank you so much, Rebecca. It's great to hear back from the country on how the PSAT has been used and what the next steps are. So now I'm going to turn it over to our colleagues working on the Global Fund Strategic Initiative, who are going to give us practical experiences of using it at a regional level. And so that I'll hand over to Ilona Tosca and Jane Ferguson. Ilona,
thank you very much, Ayesha. Thank you very much, Ayesha and colleagues. We'll whiz through this, so there's time to hear from you. And Jane is really the person who has done most of the thinking on this. But on the next slide, it's an overview of how we're approaching the work that we're doing with Hillary and Kaya. I think I saw both of you on this call, and Ayesha and a few colleagues from the countries that we're supporting, which are 5: Cameroon, Eswatini, Kenya, Lesotho, and Mozambique. And our goal is to think together about refining adolescent girls and young women HIV programming in the 5 countries. We have until the end of 2023 to do so. And we've started with meetings with all the 5 countries and are focusing on Lesotho and Mozambique in the next few months to try and do what is laid out on this slide. So in collaboration with stakeholders, and in some countries it's not AGYW focused, it's adolescents and young people more broadly, and we are adjusting as needed to that. We're starting with what Hege was speaking to earlier, so using tools on estimates of population, data and literature reviews on what are drivers of HIV and factors quantitatively, and if not qualitatively linked to HIV risk and HIV incidence, and then trying, which is the need, what is the epidemic in each space and where are the priorities, and then to also map out what we're calling the response, so the know your interventions. And this is really where we see the PSAT tool that fit in with our work, and Jane will explain how we're thinking about doing that. And then together, sort of bringing the match of the needs and the response, the goal is to come up with recommendations that can then also be costed and modeled in partnership with Avenir Health, who some of you may have worked with, which will then refine the recommendations even further. Oh, thank you, Carrie. Sorry, I forget. And work with colleagues at UNICEF. I see Ayesha here, Alice and Laurie, and the Wakara office to then implement and support the implementation of some of the recommendations in each country. In the next slide, and then the next slide is just to say clearly, for example, how we're looking at the interventions. So we've chosen, as in Hege's slides earlier, key interventions that are in the recommended package. And we're asking, what is the evidence on the effectiveness, but also acceptability of some of these key interventions that could be part of a package on HIV incidence and risks and other national strategic goals amongst adolescent girls and young women and their partners. And we're doing it by country, but also extending to neighboring communities when there's no data specifically from the country. For example, we're working with a London school team that has the DREAMS evaluation data and experience to try and understand how the DREAMS evaluation data from Kenya and South Africa may help us with refining programming in the other countries. In the next slide, I'm going to hand over to Jane. Jane, is that right?
Yes.
I hope you're still here.
That's fine. This is the slide that thanks, Ilona. This is the slide that places only one part where we're using the PSAT out in the upper left-hand corner. Part of what we're doing is looking at national guidelines, strategies, and policies. We're doing a national framework review, as we're calling it. But this is just to show how it links to the other parts of the intervention reviews that we're doing. And this is important to our kind of overall thinking, because we know that the Global Fund is really very keen to make sure that the work that they support is supporting what's already in national programs and supported by national frameworks. So we were looking for an approach which was evidence-based, and of course there are tools, and there's lots of evidence tools around. And when the AGYW PSAT came to our attention, we were very pleased, because it does provide a very nifty way, a comprehensive way, but also a very nifty way to look at that key aspect of national guidelines, strategies, and policies. Next slide, please. So we are only looking at three of the elements. It's only the program management part of the slide that Carrie showed. And we're not doing it in the same process, we're adapting the process. And I'm saying this, we haven't done it yet. We're just introducing it to Lesotho colleagues tomorrow. And we'll show you the kind of the way in which we're expecting to do it. But this is, this picture here shows you what the actual tool looks like, the questions on the tool itself. And I won't go now to, but in the document scan, that's something that we have developed, which is really a listing of international guidance and tools and strategies related to, of course, including the UNAIDS ones, but all the WHO ones and some from key partners as well. And we've used that to then do a search of all those documents that are available at country level. And we'll start out with that with our country colleagues to say, what are we missing? So this you can take a look at it later. It is an active link here. Next slide, please. Just conscious of time. So we've also developed a little bit of a worksheet, and this is what we would do. So what we're planning to do is, unlike the PSAT process, which is really led by a group in the country, we're asking the country to identify some people that we will work with. But first, we're going to look at the documents ourselves and try to answer some of these questions as rapidly as possible, and then go to the country and say, this is what the documents say. Could you help us interpret them, please? Are there really these gaps here, or are there some things that we've missed? Or is there something that you think needs to be done? Or we're just kind of doing some of the heavy lifting at looking at the range of policy and strategy documents that are available in these countries. In many countries, I think of Kenya, for example, what Rebecca's just talked about, there's many, many policies and strategies and guidelines which help support programs, which are important to look at. So this is just a checklist, and hopefully this will help the countries to then say, okay, here's a review of the actual documents, and here's what this has said. Okay, next slide, please. And so this is really the overall process that we've been engaged in. And so I'll take you to the upper right-hand corner. This is the draft that we're going to be discussing with Lesotho tomorrow, where we're going to be talking about our process with them. We hope that it will take an hour, and looking at the overall PSAT tools, the worksheet that we've developed. So that really is only looking at about 35 questions. And the policies that we've identified so that they can help us. We will then actually look at the policies themselves, and with the help of stakeholders that they identify, then they'll be able to validate it, a document, and then we'll come and review it on the basis of their comments. So we're down at point C now, and then moving over that we then hope to, on the basis of their comments, we hope to then combine it with the piece of work that Ilona spoke about right at the beginning in terms of looking at the need. So what have we found in terms of looking at Lesotho data about the epidemic and the drivers, and then have some discussions with national stakeholders about the two, so that we're able to say, okay, if this is what the epidemiological situation looks like and the drivers, and this is what the policy situation looks like, what sense can we make out of that together? And so then that is section E in this overall slide. So it's just to give you a sense of the process, so which is a little bit different from the PSAT that Carrie has identified. It is involving stakeholders iteratively, and of course, it's kind of, we can't do without it. And we look forward to getting back to Carrie and company and UNA's colleagues and Global Fund colleagues to see how it works and see what countries think about our process. And we're hoping it's not too onerous on their part. And I think I'll stop at that point. We've just about done our time. Thank you.
Great. Thank you so much, Ilona and Jane. It was great to hear more about the Global Fund Strategic Initiative and the different ways in which the PSAT can be used. So I'm now going to turn over to Sibongi Kosi and Lakmo, who are from Zimbabwe. They are our youth country champions, and they are going to share some reflections on their involvement in the completion of the AGYW PSAT in Zimbabwe. Please go ahead. Lakmo? So Nikosi, can you hear us? If you're speaking, you are on mute.
All right, compliments of the day to you all. Confirm if you can hear me.
Yes, loud and clear, thank you.
All right, thank you very much. So my name is Lakmo Benson Pamidzai from Zimbabwe. I'm the current national facilitator for Young People's Network on Sexual Reproductive Health, HIV and AIDS. Apologies, we are not going to switch on our camera because of a poor network, but I'm here with my colleague. I'll give her this opportunity to introduce herself.
Good evening to you all. My name is Bonginkosi Mshakaidze, and I'm the National Secretariat for the Young People's Network on Sexual Reproductive Health, HIV and AIDS.
All right, so we are here to share with you our role as young people in completing and utilizing the AGYW PSAT-2, especially in our country, Zimbabwe. Next slide. All right, nothing for us without us. So I think this is not the first time you are hearing this statement, because this is the statement which we usually say as young people all over the world, especially when we are referring to issues of meaningful youth participation as well as engagement. Next slide. So I think the most important thing that we need to note before we go any further is that it is our right as young people to meaningfully participate in our own development. If we participate, I want you as stakeholders here present to understand that if you involve young people to participate, I usually like to refer to us as young people, not as beneficiaries, but as rights holders. This will in turn leads to what we call sustainable and effective programs. So as the coordinated voice of young people in the national response to HIV and AIDS in Zimbabwe, we did a survey where we asked our peers about the barriers they face when it comes to meaningful youth engagement, and we gave them an opportunity to imagine a world where, when it comes to the issues of meaningful youth engagement, their answers were very clear and they were straightforward. So they gave us something that we have summarized into the 6 points that you are seeing on the screen. But in a nutshell, they actually told us that there is really no such thing as the voiceless, but our voices, they are only deliberately silenced and preferably unheard. So it is really important that as stakeholders here present and others whom we are going to share this recording with, it is really important that when we invite young people in spaces, you trust and accept our role at the decision-making table, and you make sure that the environment is enabling for us as young people to be heard. Next slide. So why was it easy for Zimbabwe to involve young people in the completion of the PSAT 2? I know if it's not something that you usually do on a daily basis, it's very difficult for you to start at a certain stage. So this is why, as a country, it was very easy for us. So in Zimbabwe, we have a youth network which advocate for SRHR and HIV issues among young people. So the name of the network is Young People's Network on Sexual Reproductive Health, HIV and AIDS. So this is a network for young people in Zimbabwe between the ages of 10 to 24. So our main role as the network is to be the coordinated voice of young people in the national response to HIV and AIDS. So we inform the district, provincial and national response to HIV and AIDS in the country. So this network was convened by our National AIDS Council of Zimbabwe with support from the Ministry of Health and other UN agencies. So as we are speaking right now, the network is present in all the 10 provinces of Zimbabwe and in the 85 National AIDS Response District in Zimbabwe. And each district do have members which are coming from a minimum of 16 key youth sectors. So these sector representatives, they do serve a 2-year term whereby they will be identifying issues or challenges that are facing young people in their sectors. After identifying those challenges, we have the opportunity to take part in different platforms where we will advise whether the political leaders, the stakeholders who are in HIV programming on strategic action to take when it comes to addressing all these issues. Next slide. So since 2007, so this is the 14th year, the network is still surviving. The network has amplified the voices of young people from local to international level on SRHR issues. From the screen, these are some of the documents which the network has helped in developing after consulting our constituents as young people. So in a nutshell, we as the network, we operate under the premise of the universal health coverage, as we know that prioritizing young people is key when it comes to renewing our fight towards ending AIDS by 2030. So I will hand over this time to my colleague,
All right, thank you, Lakmore. So during the populating of the PSAT 2, we were called in as young people so that we could effectively engage in the populating of the 2. So our role in populating the tool was not the traditional tokenistic or decorative participation that we're used to seeing most of the time, but it was meaningful youth participation, and there was ownership of the entire process from beginning to end. I remember when we started, we relegated ourselves to the data capturing on the laptops, and one of the coordinators said, no, this is your tool. It's supposed to advise your programs. So instead, let's alternate on the data capturing so that everyone's voice is heard. So there was working with the adults meant that we all participated on equal terms, and the adults that were involved in the process merely provided us with technical support and guidance. So whilst it was adult initiated, there was shared decision and consensus with young people. Working together with adults to us is crucially important as young people, because we do not want young people to participate only in a separate space, and we acknowledge that we can learn a lot more from older people. We have come to the understanding that as young people, we also want to be engaged, but our older peers have been in the field for much longer, and they know what works and what doesn't. The process took place in a good enabling environment for us as young people. It was a safe space where we could eloquently air out the issues that we were facing. Next slide, please. So the key insights and experiences from engaging with the PSAT tool was that it provided us with the opportunity to identify and discuss issues of marginalized adolescent girls, young women, and adolescent boys and young men. Because prior to this, you'll find that there were very few interventions or spaces where we could discuss the issues that we were facing in a safe environment. So particularly key populations and persons with disability that have often been missed in HIV prevention interventions got a chance to eloquently convey the issues that they were facing. Having stakeholders from various organizations all around one table and having one structured conversation provided an opportunity for knowledge sharing and knowledge transfer. One gap, whilst there were numerous gaps that we identified, the most pronounced was that on adolescent boys and young men. There are very limited interventions that are targeting adolescent boys and young men. There is not enough statistical data and indicators for adolescent boys and young men, which makes it difficult to advocate for programs for them. Next slide, please. In conclusion, there are no excuses for not meaningfully engaging the youth. Barriers to the participation of young people need to be removed, and support for their meaningful engagement and leadership in all SRHR-related processes and decision-making spaces needs to be scaled up to ensure the sustainability of responses led by young people. Young people need access to accurate information and training, and when necessary, in order to effectively understand the technical content and the stakeholders with whom they are engaging. Adolescent girls and young women PSAT should be completed with meaningful youth engagement, and we believe that Zimbabwe can share how and what this means. Next slide, please.
All right, thank you very much. So we'll end our presentation with a quote from the former national facilitator of Young People's Network, whose name is Yamura Inyoni, and we quote, "With aspiration and experience in our own right, we are taking what is within our grasp to build a better world. This is the power we hold as young people to reimagine the world with the tenacity, innovation, and courage to disrupt every cycle that yields negative results for women and girls." With that, thank you.
Thank you so much. I think that was really refreshing to hear about your engagement, completing the PSATs, and just the opportunities and platforms that are available in Zimbabwe. So I think a lot of lessons were learned that we can carry through. So I'm aware that we are running behind on time, and I think that we have realized that a lot of people who may have wanted to join this webinar haven't had the opportunity to do so. And so we decided that we were supposed to go into a Q&A session, but we think that it would be best if we reschedule that for another time. So invite all the speakers to join a discussion forum at another time where everybody can join and engage. And so we will share this webinar, the recording of this webinar, so that people have an opportunity to watch it and then can come to that Q&A session at a later date. And so we will share details about that at a different date. So I just want to spend the last few minutes handing over to Kaya Lewis from the Global Fund to share some remarks. And then I think we will move to closing remarks after that. Kaya, can I hand over to you?
Yes, and thank you. And we've battled some technical issues, but I really enjoyed listening to how this PSAT tool is being used. And I just want to say it's such a wonderful thing to see the collaboration between all of our different partners. The AGYW strategic initiative at the Global Fund is working with UCT and UNICEF and also WHO. And our partner in so many things is UNAIDS. And so we were all able to come together to learn about the tool. And we heard today how it's something that can be used and modified to help countries identify their prevention needs. I also just loved how our young people and the youth were able to be engaged in a process with a tool like this that is really not so difficult to use and a way to engage all of the people that we're all working to serve. And so I really appreciate the time that we've had and encourage people to look at the tool, go to the Global Prevention Coalition website and continue to see how this can be used to really help identify what needs to happen in the places where you're working. Because being able to know and hear from community, from all the important stakeholders, what actually needs to happen is the first step into figuring out how we're going to do our work and how we're going to work to really create the best and healthiest environment for young people especially, and for our communities. So thanks to everyone today for sharing. I learned so much, and I look forward to the next session when we can have a bit more Q&A on the particular topic. Thanks.
Great, thanks so much, Kaya. Yeah, I completely agree. Definitely looking forward to engaging further with all the speakers. Okay, so now I'm going to hand it over to Ngandwe from the SRHR AIDS Trust to give some closing remarks.
Hi, I hope my audio is fine.
Yes, it's great.
Great. So thanks everyone. And first of all, I'd like to just say that I hope that the next rescheduled call will be able to really just have everyone on board. I am also one of those that had challenges joining the call, so I hope that next time it will definitely be better. However, I did manage to listen to the last presentation by the team from Zimbabwe. And I really just want to say that there are so many common challenges that I have actually noticed between the interventions that have been shared from the team from Zimbabwe. And I know that these are challenges that we can relate to, more especially as young people. And just like the previous speaker, I would like to acknowledge the voices of young people, which continue to play such a key role in making an AIDS-free generation a reality. Because I always like to say that meaningful youth participation in any intervention, especially around HIV, is the only way we can actually end AIDS and make sustainable and realistic interventions and plans to actually end HIV. So I'm really looking forward to learning some more and listening to what other partners are doing across the network, but also to just thank the organizers of the webinar and key partners that are working so hard to make this webinar a reality, but also all the tremendous work that partners are doing across the network and outside as well. So thank you so much. I'm really looking forward to the next rescheduled call, but also to have more insights into what we're actually planning to do. So thank you so much and see you soon.
Great. Thanks, everybody, and apologies for all the technical difficulties that we had, but we hope that you can all join us for our next call. Have a good day.